Now at 5:45, a surge in illnesses, including RSV, is crowding emergency rooms and causing concerns from doctors that it's only the beginning of what could be a busy winter season.
10 TV is learning when some parents are taking their children to the ER, they're waiting as long as 8 hours to receive care here in Ohio. 10 TV's Lindsay Mills is asking why ERs are being flooded with patients and what health officials are doing about it. Lindsay.
Andrew and Yolanda, that's time no parent wants to spend at an emergency room. So here's a live look at that wait time at Nationwide Children's Hospital downtown. This is a good resource to use if you plan to go. And so right now, the live time is an hour, 19 minutes to an hour and a half. Average wait time, that's an improvement from what it was earlier today. And as I found out today, it really comes down to staffing challenges. Long wait times at emergency rooms across the state due to a sharp rise in RSV infections and a decline in staffing.
It looks like a little over 4,000 beds have been taken offline just because of the workforce challenges right now.
And more physicians are retiring, in some cases early. This workforce challenge could be long from over.
Right now, the projections, even 5 to 10 years out, are pretty extreme.
Would you say there's an urgent need right now to help steer parents in the right direction of whether to call the pediatrician or go right to the emergency room?
I definitely would.
To help parents with exactly when and where to seek care, new guidance will be posted to the Ohio chapter of the Academy of Pediatrics website Tuesday.
We want to see the kids that really need to be seen, but obviously always want you to follow up if things are getting worse.
It's not the first time Ohio hospitals are seeing this strain. Ultimately, hospitals work together to make sure Ohioans have access to the help they need.
We have a lot of experience handling a lot of this, particularly in recent years with COVID-19.
A statement from Nationwide Children's Hospital here in Columbus reads in part, while we do provide urgent care estimated wait times on our website, emergency departments utilize a triage system to evaluate and continually reprioritize patient orders based upon how ill or acute individual patients are. So the focus right now for hospital leaders is rebuilding the pipeline, finding ways to attract workers back with better pay and benefits while recruiting the next generation of healthcare workers.
All right, well, Lindsay, for now, is there anything that I guess doctors or anyone can give advice to help prevent RSV and prevent it from spreading and to other places and keeping kids out the hospital?
Yeah, so the obvious thing is the hygiene that we've heard so much about through the pandemic, washing our hands, covering our coughs, but we could have an RSV vaccine by next fall. 4 vaccines are nearing review by the FDA, and more than a dozen others are in testing, plus something in the works for newborns, a long-acting injection designed to be given right after birth. And by the way, if you want more on how to tell the difference between the symptoms of all of these things, COVID, RSV, flu, croup, I'm sharing more from my interview with Dr. Peltier at 10tv.com.